You're welcome. You're welcome. You're welcome. You're welcome. You're welcome. You're welcome. Welcome. Whether you're joining us from the US, from South America, from anywhere around the world, you're welcome. You're welcome. My name is Dr. Ndumiso Tshuma, and I'm from the Best Health Solutions. Yeah? Do you check speed? You're welcome. You're welcome. You're welcome. You're welcome. My name is Dr. Ndumiso Tshuma from the Best Health Solutions. And today, we are diving into something that is the power to actually change the way research is to be undertaken by, most institutions. And something that is going to change how things get to be done. And that is community-based participatory research. So, think about it from this angle. How many times have programs been designed at a national level or at an international level? Brilliant ideas, but when they come to the ground, they actually fail. Or when you come to the ground, you then discover that what you thought would work, then it turns out that it doesn't work. How many times have you seen those kinds of incidences? Then what could be the problem with that? So in most cases, you'd find that there is actually a solution to it. And that solution centers around community-based participatory research. And this is actually the centerpiece of all programming. This is the centerpiece of the manner in which things are supposed to be done on a day-to-day basis by us, program managers, who are out there in the communities, or by civil society organizations. Actually, civil society is supposed to be taking a leading role in assisting government departments when they design these particular programs, or when they come up with programs, they're supposed to jump in and say, whoa, wait, we are planning to come up with these interventions. We agree that we're going to implement this particular program. However, let's do some effective consultations as you are rolling out that particular program. Because some of these programs, they get to be implemented quickly, or for a short space of time, but there must be means through which communities take a leading role, or communities take center stage in the manner in which work gets to be done on a day-to-day basis. So, community-based participatory research. What exactly is community-based participatory research? So it's actually a collaborative approach to research that equitably involves all partners in the research process. It is actually the design of the study, design of the data collection tools, or the data collection process and the data analysis process, or the co-creation of the solution and the iterative process that happens after co-creation, where you co-create a solution, you come back, you implement, and then you come up with another solution, you come back. That continuous cycle that gets to be involved when data has been collected and when a solution, you have come up with a solution. And this whole process, this exercise of community-based participatory research recognizes the expertise or the strengths that lie between either the researchers or the academics and the civil society organizations or the community members or the people that are in the communities. I must say that in the South African context, there are civil society organizations, or there's the civil society forum that is very active, and it has got multiple sectors, 18 sectors actually in total. And all of these sectors, they've got an in-depth understanding of what is happening on the ground, and they've got their feet and feelers on the ground, because they are on the ground. They comprise of community-based organizations that are active in terms of day-to-day community activities on the ground. And when these come and collaborate with also within the civil society organization, there is the research sector that brings in the technical expertise, and also academic institutions that bring in the technical expertise. Actually, what comes out from there is an impressive piece. So key when it comes to community-based participatory research is actually the fact that this is a collaborative exercise between the researchers and the community members. But over and above that, there is co-creation of knowledge. And this exercise is key because at the end of the day, we come up with co-created solutions that are practical and tailored for that particular community. And one of the key things that we've seen is that in this particular process, we always talk about it promoting equity, where the researchers and civil society organizations or civil society forum members or the sector leaders, they've got an equal voice. They actually bring in their technical expertise, like I said, across the whole value chain. And there is shared power. And all of this ends up benefiting the process of undertaking research because it makes that research much more relevant and tailored to the communities that are being served. You would find that when they undertake research in that particular fashion or in that particular manner, it comes up with tailored solutions to the community being served. And that is one of the critical things around community-based participatory research. It's more about the co-creation of solutions, coming up with solutions that are tailored to that particular community, to that particular catchment area where that study is being undertaken. It is true that some of these community-based participatory research outcomes or products that come out from there might end up being used to influence other communities. But in most cases, what happens is that that work becomes tailored for that particular community and drives change in that particular community. It can be used as a learning also for other communities. But what is key and critical is that in that particular community where the study has to be undertaken, there is change. There are initiatives that get to be done that are tailored to that community. There is capacity building of all the key stakeholders in that particular community. Here I'm talking about even the researchers being capacitated about having an in-depth understanding of the community, about what works for that particular community, but also the civil society forum leaders, they get to be capacitated on some of the ethical practices when it comes to data collection, because these guys are from academic institutions or they are from the research background. They would bring in those expertise into this melting pot, producing something that is much more sustainable, that even with or without resources, that community has to have an in-depth knowledge in terms of how to undertake research initiatives, how to come up with continuous quality improvement, how to co-create solutions on a regular basis or on a day-to-day basis, so that whenever there are any interventions that are going to be implemented in that community, you would find that that community will be in a position to co-create practical, tangible solutions. Now, there's a part that says this aspect of community-based participatory research is actually not a method. It's actually an orientation. So it involves a change a little bit in terms of from the normal approaches, traditional approaches. It actually becomes an orientation. So this approach, it emphasizes the importance of starting with the research topics that hold significance to the community. So you would find that most of the researchers, when you're saying that you're coming up with a research topic, they'll say, but have you consulted literature? Have you checked out literature? What does international literature say? How is it happening in other countries? How is it happening in other provinces? But this one, it's more to do with, is this of significance to this community? So you would find that when we started these 6 studies, one of the key things that we did was to get a briefing session of civil society forum leaders. And then we had to tell them about, research, sensitize them about the different studies that need to be undertaken. And then after that particular briefing session or sensitization session, we then encourage them to say, you know what, just talk about some of the challenges that you are facing in the communities without involving any scientific, because some of them, of course, not all civil society forum leaders are non-researchers. Some of them have done their masters, their PhD, because within civil society, we've got lots of skilled people that are staying and living in those communities. Some of them, people living with HIV, some are sex workers, some belong to the LGBTQI community, some are part of the law and human rights community, but they're all professions in their own right, and they've done further studies. So we then say, you know what, without being all technical, let's look at what are the challenges that are significant in your community. What are some of the challenges that you're already seeing within your communities? Without wearing the academic hat, without wearing, that PhD masters. And then from there, they begin to engage, and then as sectors. And one of the key things that came out from the law and human rights sector, being led by RIA, what was around the fact around access to health services, particularly among men. And then from there, she went on to craft that idea into a mini, a topic or many concept note where he came up with a topic and then from there came up with some objectives. But the basic principle around it was around the fact that there are challenges when it comes to accessing health services in the communities. And I'm going to be unpacking this one as our case study for the work. So this is work that is currently underway, being done by one of the sector leaders, RIA, from the law and human rights sector in South Africa. Of course, they've got their own leader, who's Thabo Majuja, who's also part of the law and human rights sector as the national leader. And they are all guiding this particular process as leaders who are based in those particular communities, where RIA is taking a leading role in terms of it's got lived experiences in that particular community, has seen that there is a challenge when it comes to accessing health services by men. So she's going into the community, engaging with the different stakeholders, engaging with the health facility, engaging with men in the community, working with other colleagues who are part of the law and human rights space. And like I said, I'm going to be using this as a case study in terms of practically how they have gone around doing this particular work. But the starting point is that it was of significance to them to say that there is low uptake of health services among men, and particularly low uptake of TB-related services among men. And then from there, one of the key things around this thing, like I said, community-based participatory research is not a method. It's actually an orientation. It's actually a combination of different kinds of methods that get to be used. And also, all of this is aimed at combining knowledge and action. So there is a part that says that at the end of the day, we're making a combination of information that we're gathering from the community and some change that needs to happen within those particular communities. Like in their case, they gathered information from the community, they conducted community dialogues, they did key informant interviews over a short space of time. Actually, they did it over the period of last week. And as they were gathering information from the communities, conducting their dialogues, they then co-created a solution with the group of men that they first met with. And two of those practical solutions was actually one, the men in the group proposed that, what if we set up a WhatsApp group for men in this particular group so that we can provide support to each other? And these are men, some of them were previously diagnosed with TB, some of them have never had TB before, some of them have got family members who have had TB, and they feel like if there was a support group, some of these challenges that they went through when their family members had TB or when they themselves had TB, they wouldn't have gone through those particular challenges. And that is a solution that is coming from men who are sitting in a group discussion. So one of the solutions that they came up with. And then of course, RIA had to ask them, say, oh yeah, do you consent for you guys to participate in this particular grouping, WhatsApp group? And they came up with some group norms, group rules. And then from there, they're in the process of setting up that particular grouping. And then the second component that they came up with was, what if at our health facility, the health facility that was in close proximity to their venue, what if we had a specific day that was set aside for men, or a specific corner, or a specific period, or a specific time, let's say half of a day on a certain day, like for example Friday, let's say we say from 2 up until 4 o'clock, up until 5 o'clock, it's set aside specifically for men, and then it allows men to come to that particular health facility and seek services. So those are some of the discussion points, practical discussion points that came from that particular session, where it's not just about the fact that, oh, there's a challenge with men accessing health services. Yes, there is a challenge with men accessing health services, or there could be certain barriers that are in existence, or there could be some of the systemic challenges that are there, or some issues to do with discriminatory or practices, or the fact that there are ladies who are women that are nurses at the facility, but they're coming up with practical solutions that could assist them access the health facility, but also be retained in care. So this is a clear-cut example of the fact that at a community level, within the catchment area of the facility, solutions are already in existence. So based on that, then Ria now has got an assignment to do. So she went back to the leader, Tabo, and then had an engagement with him in terms of, oh yeah, these are the challenges that are there within the communities and what are the potential solutions to that. They have also proposed these kinds of potential solutions, of which the next level that they are going to be doing, they are going to be reaching out now to the health facility, where they will be having a discussion now with the health facility. What do you think? These are the focus group discussions that we have had. We've just had our initial focus group, but this is some of the suggestions that are coming out from here. The good part about it is that they didn't do this study on their own. They've been reaching out to various stakeholders, sensitizing them about the fact that they will be undertaking this kind of study, and this is what they want to, the solution, the problem that they want to solve. It's around men accessing health services. So as the law and human rights sector, one of those is around access to health services, to ensure that everyone has got equitable and access to health services. So there is that part which says that it combines the knowledge, scientific knowledge, but also it combines it with the action, where we want to look at the action so as to drive social change within the communities. But at the end of the day, we want to improve health outcomes within those particular communities, and of course eliminate any of the health disparities. So this is what makes this approach so unique and very relevant at this particular stage. And what are the principles of this community-based participatory research? So, like I said, it's more about just a recap around the co-creation of knowledge and using communities as equal partners. It's about equitable partnership, where there is shared decision-making. So in this particular case, I'm part of the investigators, and Riam and other colleagues from the law and human rights sector, they are also part of the investigators. We are all at par. But Leah is coming in with an in-depth understanding of the space, of the community, of the challenges that are there. But also there is mutual learning and capacity building. So from the side of Ria, it's capacitating the researchers around this is what is happening in the community. There is no way that as researchers they would have known about what's happening in the communities. These are the practical things that are there in the communities. But also from the side of the researchers, they are bringing in aspects to do with ethics, aspects to do with what are some of the ways of data collection, what are some of the different methodologies that can be used, how best do we interpret this particular data. But also, RIA has got expertise in terms of interpretation of data from a practical perspective. So brings in that community feel, and when these two things come together, it produces something that is actionable and tangible, and something that will drive change within the communities that are being served at this particular stage. So the other thing that I would want to talk to is around the steps and processes when it comes to community-based participatory research in practice. So key, one starting point is that identifying and engaging the communities. Because in this particular case, that's now RIA, to say that kickstarting that process and engaging with her to say, hey, so in our case, we reached out to the law and human rights sector. and say, yes, this is of interest, please craft it, please sharpen it. What is your idea around, what is the problem that you would want to solve for? But we had to identify that particular community that she wants to solve for. And after identifying that particular community, then there is the crafting of the data collection tool, the initial data collection tool. Now, that initial data collection tool was a qualitative data collection tool. So you will find that when you come to community-based participatory research, the key thing that we want to answer for is the why question. Why are things happening this way? What could be done differently? How else can we solve this particular problem? What are the different modalities or approaches that this problem can be solved? And then from there, we then co-create a solution to that. And mostly this gets to be done using qualitative methodologies. And this oral, you'll find that oral history has been handed over from generation to generation, through us talking about it. And there is an aspect of information being handed over from community to community through people talking about it. So there are challenges that are being faced in the communities that need to be spoken about, and solutions need to be spoken about, and we come up with practical solutions in terms of how change could be driven at a community level. And that is one of the strengths of this community-based participatory research. Then, of course, after that data was collected, like I said, two elements came out. One was the setting up of WhatsApp group. The second component, it involved having Fridays or specific days that are designated for men. And these two have now led to the second leg of the study, which is the quantitative study, where we want to now get a questionnaire out, which will be a closed-ended questionnaire, which will be trying to look at, on the side of WhatsApp group, its acceptability of WhatsApp group. What are the kinds of aspects that we want to be covered in these particular WhatsApp groups? And then on the side of the pathway, we would want men to be going in on a specific day, where we get to pick on specific days and get to pick on specific times, and then we get men to actually indicate which times and dates would best suit them. And that would be a quantitative one, because we want to do a count in terms of which days will be suitable, which times will be suitable, and then we marry those two and see what is acceptable in that particular community. So you are seeing a situation where we are adopting an exploratory mixed method approach. Now, who comes in with the exploratory mixed method approach? It's now the researchers. But from the side of the community, they ask the question, we quantify the thing, and then from there we get the answer. And then the researcher will be like, yeah, it's an exploratory mixed method approach. It's a unique way of doing things. But the bottom line is that all of this is community-based participatory research. Then when we have come back with the quantitative data, we will then come back and make another follow-up presentation to the same men, to the same community, to say, based on the quantitative data, this is what came out. And then that would be now the validation exercise, whereby we're saying that, you know what, do you think that this will work? And also we begin to involve the health professionals in that particular process. And even prior to that validation exercise, we would also share the quantitative tool with the health facility staff, so that also they can get a feel of it. They can also respond to those similar questions and say, okay, from their side, these will be the times that will be suitable. And then from the side of the community, this is what will be suitable. Then we marry the two and we try and strike a balance. So that balancing act is our act of data triangulation, where we are bringing in data from the health facility, quanti, and then we bring in the qualitative aspects, we mix it together, we come up with something in the melting pot, and then we bring it into a validation exercise. All of that is key when it comes to community-based participatory research. So, maybe just to reflect on some of these aspects. So I've been talking a lot around community-based participatory research, but now the question is, how does it actually differ from traditional research? So, from what I've just said so far, you would find that traditional research, when it comes to the role of the community, it used to make the community members to just become like a subject of research. But when it comes to community-based participatory research, they are actually partners in this particular research. They've got an active role from conceptualization, up until the iterative process where you're going on in circles and on. And even when it comes to publications, implementation, and all that, they are part of that particular team. So they are active participants in the study. When it comes to the research goal, you will find that generally the goal of traditional research was normally around knowledge generation. So it was mostly around what is new that you're going to be contributing. I remember in one of the meetings, someone asked, what's the new thing that you're going to be contributing to science? Have you consulted international literature? Have you done a literature review? And you'll find that that is traditional research. But when it comes to community-based participatory research, it's more about social change, localized social change, localized changes within our communities. And when it comes to decision making for traditional research, it's largely researcher driven, where the researcher needs to crack their mind to say, oh yeah, this is what needs to happen, this is what could potentially be, oh yeah, the discussion section is actually informed by the researcher coming through and saying, yeah, but this could mean this is in line with this literature and that literature, and that is the traditional research. But when it comes to community-based participatory research, it's more about shared knowledge and ideas between the researcher and the community. And actually, civil society plays a key and a critical role because of in-depth understanding of the community, much more than this. So the voice of the community is much louder than the voice of the researcher when it comes to community-based participatory research. And when it comes to, say, data collection, you will find that the data collection for traditional research was more of extractive, like the mining part, extractive, and it was researcher-led. But the one for a community-based participatory research, it adopts a much more collaborative and participatory approach in nature. Like I said, RIA went into the communities, engaged with the men in the communities. They came up with practical challenges and practical solutions in the communities. And that makes a very huge difference. And when it comes to the use of those particular findings, is that you will find that for purposes of traditional research, it was largely meant for either you're doing it for your thesis, or you're doing it for maybe abstracts and articles, for publications, for your advancement in your career. But specifically for community-based participatory research, it's meant to drive change in your communities, to influence policies, to influence practical implementation of programs within your communities. And also, when it comes to, I think this one is the engagement level, where we are engaging with the community members. It was largely minimum when it comes to that interaction with the community, because you're getting there, you extract what you want, and then after extracting it, what do? You go and write your thesis quietly somewhere. After the data collection phase, you no longer go back to the community. But when it comes to the community-based participatory research, you will find that in that particular case, it's a continuous process. There's continuous engagement. There's continuous interaction with the communities. Like, for example, in this particular case, they had their dialogues, but they are still in touch and they are engaging about the solution. She's feeding back to them to say, oh yeah, this was an interesting aspect. They set up the WhatsApp group, they set up that particular WhatsApp group, but they are continuously engaging in the communities to ensure that practical solutions get to be generated. And I think this transition from traditional to community-based participatory research is actually key and critical for the growth and sustainability of organizations at a grassroots level, but also for the implementation of policies, frameworks, whatever gets to be designed by government or by international agencies. Because you'll find that for sustainability, we need such level of shared leadership between those that are coming from academic institutions, those that have studied the matter for some time, and those that have got lived experience. And then we enhance the capacity of those that are actually in the community, but also enhance the capacity of understanding of community needs, so that these researchers, as they are growing, as they are coming back to the communities that they are coming from, they understand the needs of the community, they understand the lived experiences, they understand that technical expertise actually lie in communities. Practical, tailored solutions actually lie in communities. And this shared leadership is going to translate to long-term sustainable interventions within the communities that we serve. But of course, these kinds of interventions would come to our communities, and it does not mean that there won't be any challenges as we are implementing these particular programs. And in some cases, you would find that some of these practical challenges that we tend to face in these communities, they could potentially center around power dynamics. To say that, because in most cases, when the people go back to these communities, there are still certain perceptions and impressions that the community people or the civil society organizations could be having about the researchers. So they could potentially feel like these colleagues, these researchers that are coming through into our community, they could potentially be coming here to extract. Because history has it that, other fellow researchers have come through into the community, extracted, and then gone and did their studies, and then from there forgot about the community. So it is important to address and outlay these fears and clearly state the difference between the two approaches so that we could be in a position to undertake such studies. We could be in a position to go into those particular communities and explain to them the value of undertaking community-based participatory research. So that in that particular fashion, we are in a position to let them know who benefits in the long term or even in the medium term. So one of the key things is around the fact that when you go into that community, you're coming up with tailored solution for the community that is being served. So which means that particular community gets to be served. And the interventions that are being implemented in that particular community. For example, in this particular case study, where we talk about Ria solving the problem of men accessing health services. But after solving the access to health services, she sorts out the problem of retention in care. So what does that mean? It means that some of these men, at this particular moment, they could be healthy. They might not be having any non-communicable disease. But the fact that they are now in this particular cohort of men that are engaging on health, social, and economic issues, they are going to be retained in these particular groupings and they will stay informed. Let's say, for example, there is an outbreak of COVID. And when there is that particular outbreak of any disease, then they are in a position in these particular groupings to say, okay, these are the signs and symptoms of this particular disease. Or let's say there's a flood. They're in a position to say, oh yeah, there's going to be a flood, or they're going to be informed about incidences of such. But also they could potentially be, let's say, maybe load shedding in their particular community, or they could be maybe a theft that happens, or even GPV that happens. They will be in a position to sensitize each other. They will be in a position to talk to each other. They will be in a position to give counsel to other fellow men. So some of these things are the benefits of setting up those kinds of groupings. Because most of the people that are in the communities, they would want to know about the benefit of participating in these kinds of initiatives. And it is key and critical that we outlay their fears. We outlay their fears. We come up with, we let them know what they could benefit from this particular process. And in most cases, it's not so much about them benefiting directly, like financially. In all cases, it's not about them benefiting financially, directly, but it's about them benefiting their community and their community being a conducive place for them to live in. For example, let's say maybe that man is being abused by a woman. They're in a position to talk to this grouping of men that have got an in-depth understanding of the challenges that men are facing in the community, that are not likely to judge them as men, but they're likely to understand their situation and comfort them and console them. They're actually building their network among other men so that they can bounce off ideas when they're stuck. Some of the fears, they could center around the fact that these researchers are coming and they know it all. And it is key and important that as researchers, we come into that particular community, we indicate that, you know what, We have come up with lots of interventions, and these interventions have not worked. We have all these health facilities, but we are seeing that there is a challenge that men are not going there. And we find that instead of us, coming up with programs, redesigning programs, it is best for us to actually come and talk to men about men problems. It's best for us to talk to women, LGBTQI community about LGBTQI problems. So because we might not be having those lived experiences of that specific community. And we would want to learn more about this community, but not only for our own learning, but also to share some of the experiences, but also to get to know exactly how best can we solve this particular problem jointly. So the core of us coming together is so that we can co-create a solution that is practical and tailored to the community. So those are some of the things that we need to highlight when we're going into these communities. Because we need to reflect on some of the potential fears that could be having, some of the aspects that could deter participation of community members in some of these co-creation activities. In some cases, when they sit there, they are looking at us as academics, they are looking at us researchers as people that know it all, but we need to highlight the fact that it's not like we know everything. There is actually a wealth of knowledge that is sitting in the communities that has never been disseminated, and this is the information that we're looking for. And one of the key things is that as we go into these communities, like for example, Ria, she translated the tool to local languages and made it a point that it is tailored in such a manner that it is easier to understand and it flows. And she looked at culturally acceptable and sensitive aspects of that particular tool. And then she tailored the initial qualitative tool for that particular community so that she would be in a position to pose questions and probe in a culturally and socially acceptable manner without sounding like a scripted session. And this is one of the key and critical stages that broke that ice. Because when she got there, she greeted them, she made them feel comfortable, she made sure that everyone looks at her, not just as an external person, but also as a child born and bred in that particular community who wants to come back and solve jointly with them, co-create with that particular community, solutions that are tailored to the community. So like I said, this is just but one of the 6 studies that are currently being undertaken. There are other studies that I'm going to be unpacking soon. So, anytime soon, I'll be coming back live. And I'll be briefing you in terms of some of the interesting work that is taking place in the communities. Like I said, there's a wealth of information sitting in communities. And some of these challenges that we're facing as health professionals when it comes to practical aspects of program design, they could be sorted out by engaging with civil society organizations, by civil society forum leaders in the communities that we serve. So, just in case you're having a challenge in your community, or you would want to learn more about community-based participatory research, please comment in the section below. In case you do have some interventions that you have tried out and they seem not to be working, maybe let's engage, let's collaborate. Let's see how best we can take this community-based participatory research forward. How can we ensure that in all the communities that we find ourselves in, we undertake community-based participatory research? Thanks a lot for making time to meet with me today, and hope to see you in our next session. Thank you.